Thank you for joining us today for this Medicare webinar series and today's topic, Medicare Part D, presented by the Pikes Peak Area Agency on Aging. We want to thank the Park County Extension, Park County Senior Coalition, the Seniors Alliance of Platte Canyon, and our hosts for their support of this webinar series. Before we begin, we ask that you please mute your microphones until we reach the question and answer portions of the presentation, and then you may use the raise hand function or the chat area to let us know if you have a question. And now it's my pleasure to introduce our presenter, Roma Costanza, State Health Insurance Program Coordinator and Case Manager at the Pikes Peak Area Agency on Aging.
Thank you, Jared. So good afternoon, everyone. Thank you for joining us. Looks like we finally got our other host site in. So I'm glad we waited. There we go. There we go. All right. So again, thank you for joining us for our part 3 of our 4-part series, Medicare 101. This week, we're going to talk about Medicare Part D specifically. Hopefully everybody received the email that I sent earlier this afternoon that included the handouts if you're joining us virtually, or hopefully you have the handouts if you are at a host site. As usual, I will pause during the presentation to see if anybody has questions. When I do pause for questions, you're welcome to simply unmute and ask your question, or you're welcome to raise your hand within the Teams screen, or you can type a question into the chat box at any time, and I will address them when I do pause for questions. We have a lot of information to cover, but it's not going to take overly, overly long. So hopefully we'll get you out of here in a timely manner. That looks like, let's go ahead and get started. So just again, as always, I am with the Pikes Peak Area Agency on Aging. The mission of the Area Agency on Aging is to work with our partner governments in our 3-county region of El Paso, Park, and Teller to provide leadership and find and develop programs that allow people to stay in their homes and in the community for as long as possible. I am the coordinator for the SHIP program, which is the State Health Insurance Assistance Program, which is a federally funded program that's designed to provide unbiased information and education on all things Medicare. And my SHIP program covers a total of 9 counties in Colorado. Every county and every state has access to a SHIP program within their state, if nothing else by a toll-free statewide number. On this slide, I've listed both the Colorado Springs office number and our statewide toll-free number. Just a brief note that Medicare and the Administration for Community Living, which is who oversees the Medicare program, is doing a national ongoing survey. What that means is if you get a phone call from a third-party entity that says they are doing a Medicare survey in regards to a presentation that you recently attended from a SHIP office, it is a legitimate survey, and we do appreciate you answering questions or participating in that survey because it does help continue our funding. So just a brief recap of what we've talked about already in the last 2 weeks. In week 1, we talked about Medicare A and B. We talked about eligibility, enrollment, coverage, and costs. Last week, we talked in depth about Medicare supplements, also known as Medigap, and Medicare Advantage plans, and the differences between them. And this week, we're going to talk about Medicare Part D, or D for drugs, the Medicare prescription benefit. So, what is Medicare Part D? So Medicare Part D is actually the newest benefit of Medicare. It is a over-the-counter or pharmacy, not over-the-counter, but a pharmacy prescription benefit that went into effect in 2006. Prior to 2006, Medicare did not cover prescription drugs, and that was a cost that people had to incur out of their own pockets. The way the Medicare Part D drug benefit works, and again, this is for pharmacy prescriptions only, is all of the Part D plan options will include formularies, which is a list of the drugs that they cover. and they must include a wide range of different classes of medication in their formularies. Typically, if you, depending on how you get your Medicare Part D benefits, you may have to pay a monthly premium. You may have to pay a deductible with your Part D benefit, and you will pay copays at the pharmacy for most of your prescriptions. There is also financial assistance available for people who have limited or low income that is specifically designed to help cover some of the costs of Medicare Part D for people with Medicare. So I do get more questions than I honestly thought I would about whether or not someone needs to enroll in a Medicare Part D. As with all benefits of Medicare, it is optional. Medicare is not a required benefit for you to have to enroll in. It is always optional. In order to be eligible to enroll in a Part D plan or prescription benefit with Medicare, you must be enrolled in at least one part of Medicare, either Part A or Part B or both. But you have to be enrolled in at least one part of Medicare in order to be eligible to enroll in a Part D. If you have something that's considered creditable coverage already, for example, if you are a veteran and you access the VA pharmacy, that would be considered creditable drug coverage outside of Medicare, and you would not have to enroll in a Medicare Part D because you already have drug coverage that's considered as good or better than what Medicare Part D can provide you. If you have a retiree benefit that includes creditable Part D coverage or drug coverage, if you have employer coverage that has good drug coverage, anytime you have another means of getting a drug benefit, and that benefit is considered as good or better than what Medicare offers, it means that you wouldn't have to have or have to enroll in a Medicare Part D in order to have that drug coverage. If you don't enroll in a Part D because you have those other options, if for some reason you needed to enroll in a Part D in the future, say, for example, the employer plan, you stop working, or the retirement plan changes its benefit structure, if you lost your creditable coverage and you had to enroll in a Part D, because you had that creditable coverage, you would not be penalized for late enrollment into Part D. If you have that other creditable coverage, it may still be to your advantage to compare that coverage to what you might be able to get through Medicare. And when you're doing that comparison, you'd want to look at what kind of copays you pay for your current coverage versus what you might pay for a Part D copay, what the premiums might be, those kinds of things. What the list of drugs are covered, make sure all your drugs are covered. If you decide not to enroll in a Part D and you don't have those other prescription coverage options, again, you can enroll in a Part D any year down the road during an enrollment period for that benefit, but you may be penalized, meaning you may have to pay more because you didn't enroll in a Part D when you first became eligible and you didn't have that other creditable coverage as a reason not to enroll. I do get a lot of questions from people. What if I don't take any prescriptions? It's a perfectly legitimate question. Why should you have to buy or enroll in something if you don't take any drugs? And the bottom line is the reason Medicare imposes penalties for anything is to discourage people from waiting until they absolutely need it before they enroll and start paying for it. They really want you to look at Medicare insurance coverage the way you look at any other kind of insurance coverage. In many cases, we're required by law to pay for insurance. We certainly don't want to have to use it, even if we have to pay for it. Medicare wants you to look at it the same way. They don't want you to wait until you have been diagnosed with brain surgery before you enroll in health benefits. They want you to be paying into that system in case that you need them in the future. So that's kind of the thought process behind penalties in general. So when can you enroll in Medicare Part D? Well, a lot of the same enrollment periods are going to apply that we've already talked about. Your initial enrollment period, which is going to be that same time frame that surrounds your initial eligibility into Medicare in general. That 7-month window, that 3 months before, the month of, and up to 3 months after the month of your eligibility or birthday month. Then there's the annual election period, also known as open enrollment, every fall. That's the October 15th through December 7th. window where you can get into, get out of, or switch from one Medicare Part D to another, or one Medicare Advantage plan to another, or drop those plans altogether. Any change you make during that open enrollment period in the fall doesn't go into effect until January 1st the next year. And then there's always special enrollment period opportunities depending on a situation. For example, if you lose your coverage for some reason, that always allows you a special enrollment period so that you're able to get replacement coverage without any penalties or having to wait. As I mentioned, if you choose not to enroll in a Part D when you first become eligible, and you don't have another drug benefit that would be considered as good or better than what Medicare Part D can offer, you would be allowed to enroll any year down the road during an enrollment period. But because you have not had drug coverage in the meantime, you could be penalized, meaning you could pay more in premiums because you waited to get a Part D. The way the penalty is calculated for Part D is different than the way they calculate it for Medicare Part B as in boy. For Medicare Part B as in boy, they look at penalizing you 10% for every year you went without enrolling in Part B and you could have or should have. For the Part D, the drug benefit, they calculate the penalty based on 1% penalty for every month you don't enroll in a Part D and you don't have other drug coverage in place of that. And it's accumulating. So if you wait 12 months, you're going to have a 12% penalty. If you wait 2 years, you're going to have a 24% penalty. The longer you wait, the higher the penalty you'll end up incurring. The way they calculate the penalty, once they determine how many months of penalty you're penalized. So say you wait 2 years to enroll in a Part D, you have a 24% penalty. They're going to multiply that 24% times that year's national average Part D premium. For 2023, the national average Part D premium is $32.74. So you're going to take that 24% penalty, multiply it by $32.74. Whatever that comes out to is going to be tacked on top of whatever premium you pay for whatever Part D plan you choose to enroll in at that time. Again, once you incur a penalty, it lasts forever. It'll be tacked onto your premium every month forever. The worst part about the Part D penalty is once you incur it, the amount of penalty, the percentage of penalty, will always stay the same. But they will recalculate it every year when the national average Part D premium changes every year. So it will change, the amount you actually have to pay will change from year to year. Quite honestly, that's way too much math to have to worry about doing. So all the more reason to try and not incur penalties, simply because, again, the longer you wait, the higher it gets, and it lasts forever. Part D premiums, just like Part B as in boy premiums, are also means tested. Again, what that means is the higher income you might have, the more in premium you might have to pay based solely on that income. Same income brackets as for Part B. So you would have to have at least $97,000 annual income for a single person in the filing year of 2021 before you'd have to worry about anything related to paying a higher premium. But if your income in 2021 was high, then you would have to pay an additional amount to your premium, to whatever plan you choose to enroll in, based on that higher income. Again, these means tested premiums are looked at every year. So Social Security will look at the most current, most recent complete income tax filing that they can access from the IRS. If you were still working in 2021, had a good income, but as of 2023, you've retired, your income isn't that high anymore. When they look at your income again and your tax filing again next year, they'll see that your income has gone down and your higher premium will also go down. So it is looked at every year. It's not a forever premium, that you would incur based on that income test. All right, that was a lot. Any questions about any of that? Again, if you have a question, you can simply unmute, you can raise your hand or type it into the chat. Right? I'm not hearing any questions. I'm not seeing any questions. So let's talk about how Part D works. So again, Medicare Part D has only been around since 2006. When the government decided to allow drug coverage to be offered through Medicare, it was almost kind of like a last minute decision. And the government put together this Medicare drug benefit and all of the components that go with it in about a 6 to 8 month window. It has worked incredibly well in the meantime, which is very, very impressive for something to be that big to be put together that quickly and still work well. So the way Part D benefits work is just like with other coverages, Medicare Advantage plans, Medicare contracts directly with private insurance companies and pays these companies to act on their behalf as your Part D benefit. So when you enroll in a Part D benefit, you're actually enrolling with a company, a private insurance company, and they're going to provide that benefit for you for Medicare or on Medicare's behalf. Medicare controls how these plans work. They control what drugs these companies have to offer, how they offer them, how they calculate the costs. They vet all of the expenses, all the premiums and deductibles and copays that these plans want to charge. So they do all the policing. They make all the rules. But then they allow private insurance companies to actually be the ones who give you the drug coverage. So the way Medicare has outlined how this benefit works says that you will have an annual deductible to start with. For 2023, that annual deductible is $505. What that means is when you enroll in a plan and you have a deductible with that plan, the first time you go to the pharmacy to pick up a prescription or a refill, you may be charged full retail price for that prescription, and you'll continue to be charged full retail price for your prescriptions for however many prescriptions it takes for you to pick up until you paid $505 out of your pocket. You've met your deductible at that point. Once you've met your deductible, the next time you go to the pharmacy, you should pay a much smaller copay or a much smaller cost out of pocket in the form of a copay because you've met your deductible. You've reached the next level of your Part D coverage called the initial coverage zone. In this zone, when you go to the pharmacy, your copay should represent approximately 25% of the retail cost of a drug. So you pay 25% of the cost as a copay, and the plan pays the other 75% of the cost of that drug. While you're paying only 25% copay, and while you're paying full price during your deductible. What Medicare and the drug plan are doing is they're taking the full retail cost of every drug you purchase, and they're adding them up in a column over here where you can't necessarily see what they're adding up. So every prescription you pick up at the pharmacy, they're going to take the full retail cost of that drug. They're going to add it up in this column. If the full retail price of the drugs that you have had to pick up in this column add up to $4,660 within a calendar year, you'll reach the next stage of your prescription coverage called the coverage gap, or also used to be known as the donut hole. In the donut hole, your drug costs could change at the pharmacy. So the way this slide says it is the coverage gap, you're going to pay 25% for both brand name and prescription or generic drugs, and the plan will pay the other 75%. And you might be sitting there thinking, well, how is that different from the last coverage zone where I was only paying 25%? The difference is when after you've met your deductible and you're in that initial coverage zone, even though the minimum benefit that these plans can offer you is a 25% copay, Most Part D plans do better than 25% in the initial coverage zone. What that means is many plans may have a zero copay for generics or a $1 or $2 copay for your generics. They may only charge a $20 copay for some brand name drugs in the initial coverage zone. Once you hit the coverage gap zone, that zero copay generic, you will actually have to start paying 25% of the retail cost. That $20 brand name drug, you will actually have to start paying 25% of the retail cost for brand name drugs. So your costs will likely go up if you hit that zone in your Part D coverage. But again, you'd have to have some pretty expensive meds and spend the equivalent of $4,660 to get there. While you're in the coverage gap zone and you're paying actual 25% of the retail cost for those drugs, that $4,660 that in retail costs that got you to that zone, they're going to continue to add to that column of numbers. But now they're only adding 25% that you're actually paying at the pharmacy to that column. If before the end of the calendar year, that column adds up to a total of $5,865, I see a typo there, $5,865, then you would reach the next level of your coverage benefit called the catastrophic coverage zone. In this zone, you would actually had to have spent out of your pocket a total of $7,400, and that would include the deductible. So hopefully not a whole lot of people will hit that. But in that zone, if you are, if your costs do get to that zone, your copays at the pharmacy should go back down to 5% of the retail cost, or a $4.15 copay for generic, $10.35 copay for brand name, or less, whichever is less. Then the plan pays 15% of the retail cost, and Medicare will pay the rest of it. And that would be your coverage through the end of the calendar year. And then come January 1st, it starts all over. So every year in January, it resets. So that is the bare bones outline of how all Part D benefits work, whether you have that coverage through a separate Part D drug plan that you pay for, or whether it's included as part of your Medicare Advantage plan at no extra cost. They all work the same way. So Medicare also requires that all Part D plans cover at least 2 medications in every medical class of medication. They have to cover at least 2 of those drugs in every class on their formulary. So for example, if there are 20 different kinds of high cholesterol medication on the market, each plan only has to cover 2 out of those 20 different drugs. What that means is every drug plan, every drug benefit that is offered could have a different list of drugs that they will cover. There are 6 classes of drugs that every Part D plan is required to cover every drug on the market. Those are going to be your antidepressants, your antipsychotics, anticonvulsants, antiretrovirals, your immunosuppressants, and your antineoplastics. That's your cancer drugs. Otherwise, as long as a plan includes at least 2 different drugs out of every medical class of drug, they've met the Medicare requirement. When it comes to what Part D covers, Part D is only allowed to cover drugs that are available by prescription only, meaning a doctor has to write a prescription for you to get that. The drug also has to be written by your doctor to be used for its medically intended purpose, and it has to be approved by the FDA. When I say a drug has to be prescribed for its medically intended purpose, for example, if a doctor is prescribing someone Viagra for high blood pressure, which is a treatment that they found as a side effect almost, because Viagra was not created, that's not its medically intended purpose when it was created, Medicare would not pay for you to take Viagra as a blood pressure treatment. All plans must cover any drugs, biologicals, and insulins, and the supplies for injecting insulin. And all plans must include both brand name and generic drugs on their formulary. Of course, brand name drugs are going to be more expensive, and generic drugs are going to be on the lower end of the cost. Drugs that are not covered under Medicare Part D are going to be any medications or drugs that you take or that are covered under Part A or B. For example, any medications you take while you're inpatient in the hospital would be covered under Part A. Any medications you take or are administered to you while you're in a medical setting. So if you have to go to a doctor's office for an injection, or if you have to go to a medical center for chemo treatments, those are going to be covered under Medicare Part B. Again, the only thing Part D covers, D for drug, is pharmacy prescription drugs. Doctor hands you a prescription, you take that to the pharmacy, you go pick up the drug from the pharmacy. That's what's covered under Part D. Also will not cover typically anything that's considered over the counter. Will not cover drugs that are specifically used to treat anorexia or for fertility purposes or for cosmetic purposes only, even if it requires a prescription. Even if it requires a prescription, Medicare Part D will not cover any prescriptions or drugs that are used solely and specifically to relieve cough and cold symptoms. Guaifenesin or Robitussin is a perfect example of that. That would not be covered under Part D. And most vitamins and minerals, also known as supplements, are not going to be covered under Part D, with the exception of some vitamins and minerals that are specifically prescribed to treat a specific disease of some sort. So that is how Part D works in a nutshell. Any questions about any of that?
Do you know if a drug isn't covered by Medicare, but it is covered by Medicaid, can Medicaid be billed for it?
Yes. If you have both Medicare and Medicaid, and you have the type of Medicaid that would have normally covered prescriptions, if it's not a benefit of Medicare, but it is a benefit of Medicaid, then yes, Medicare denies, Medicaid can be billed for that.
Perfect. Thank you.
You're welcome. Any other questions? Nope, it's all clear as mud. All right. So as I mentioned, in the last couple of weeks, there is financial assistance available for Medicare costs, and there is a program available specifically to help with just Part D expenses called low-income subsidy, usually referred to simply as extra help. For this financial assistance program, you actually apply for it directly through Social Security. They are the ones who provide the financial assistance on the drug coverage. There are some people that might automatically be enrolled in extra help, and that would primarily, for most people, be if you're already receiving a benefit that comes with Medicaid, such as SSI or Medicare Savings Program. If you are transitioning from regular Medicaid, you've been on Medicaid, last few years, you're turning 65, are going to get on Medicare, you will automatically be enrolled in extra help for Part D coverage for at least 1 year after you're on Medicare. And then they'll look at your actual financial eligibility, but it comes automatically for the first year for people who transition from Medicaid to Medicare. There are several levels of extra help that could be available depending on income and assets. And again, this is something you apply for through Social Security. You can either do that online at their website, which is honestly the easiest and quickest way to do it because it only takes like 10 minutes to do the application. Or you should be able to call the national 1-800 number for Social Security, and they should help you do one over the phone. You can also call your local SHIP office. That's us, and we will help you with an application as well. And we can do that over the phone with you. I do have a question in the chat. I see good RX cards at my doctor's office. Can I use one of those to lower my out-of-pocket cost for the $505 deductible? That's a good question. Unfortunately, no. You are allowed to use any other sort of discount you can find. So if you can get a prescription at a lower cost by using something like GoodRx, you're more than welcome to do that. However, that cost would not be applied towards your deductible if you used a discount card like that. They can only apply towards your deductible when you actually pay full retail price as determined by the plan. So if you take one medication and you can get that medication for half price through GoodRx versus having that $20 drug applied to your, $505 deductible, but that $20 drug is the only drug you take and you never meet your deductible within the year, it might make more sense to let GoodRx give you the $10 discount and only pay $10 and not worry about your deductible. So it's really a matter of depending on what you take and what those costs are. But no, unfortunately, anything that you use outside of the actual Part D plan would not be allowed to be applied towards that plan. So you can do one or the other, basically. I got another question that says, by list price, do you mean uninsured price or negotiated price or something else? So this is where it's a kind of gray area. Medicare, when they contract with these companies, require that these companies submit to them in the fall every year all of the drugs that these companies are going to offer on their formularies, what their premiums will be, what their copays will be for all of those drugs. So all of that is predetermined before a drug benefit would go into effect in January. When they submit that information, they also submit to Medicare what they think the retail cost of any drug that they have on their formulary would be at the pharmacy. And that cost can change from pharmacy to pharmacy. So it's basically what it boils down to is it's whatever the drug plan, the Part D plan, says is the retail cost that would be applied to the deductible. So I don't know if that really answers your question because it is kind of a gray area. Prescription drug costs when you're paying cash or you don't have insurance do vary from pharmacy to pharmacy on a daily basis. Sometimes the cost can vary from day to day at the same pharmacy. But with Medicare Part D plans, because they have already told Medicare what they think the retail cost should be at any specific pharmacy, that's the price that will be applied towards your deductible at that pharmacy through that plan. So I hope that makes sense. Any other questions? All right. So back to the extra help. Again, different levels of assistance available for extra help on your Part D costs based on income and assets, just like any other financial assistance program. The income and asset limits for help with Part D are higher than the income and asset limits for help with Part B that we talked about in the last couple of weeks. So more people should qualify for help with their drug coverage than qualify for help with their medical coverage. Again, the application for this assistance is done through Social Security. The online application at the Social Security website takes literally less than 10 minutes. And if you can submit it online, that's going to be the quickest way to get approved. Once you're approved for extra help, what that will do is at the higher income and asset limit, it will provide you a discount to your premium. It will reduce your deductible and it will reduce your copays at the pharmacy. If you're at the lower level of the income and asset spectrum, you could get financial assistance as high as no premium, no deductible, and a maximum $4.15 generic copay, a maximum $10.35 brand name copay. If you're on a Medicaid program, you may get even more assistance than that. So again, if you think you fall within these income and asset guidelines, they do change every year based on the cost of living increases through the federal government. They only look at liquidatable assets, not your personal possessions or your home. And we can help with these applications. If anybody is interested in more information or would like to do an application, you're welcome to give us a call. We're happy to help. If for some reason you have high drug costs, but your income is too high to qualify for extra help, there may be still some financial assistance out there to help you. Typically, that is going to be through what's called patient assistance programs through the makers of these medications. If you qualify for a patient assistance program through the manufacturer, you could potentially get your prescriptions for free. However, patient assistance programs are typically only going to be good for brand name drugs. Specifically, if you still see a commercial on TV for a drug, it has a patient assistance program where you could potentially get that drug at no cost. Most of these patient assistance programs do work with people who have Medicare Part D. Some of them may require that you apply for help and prove that you were denied. Some of them may require that you only prove that you've spent a certain amount of dollars within the calendar year to qualify on any drug. So eligibility for patient assistance for these brand name drugs will vary from manufacturer to manufacturer. But if you qualify, again, most of the time you're going to get that brand name expensive drug at no cost for till the end of the year. I've listed some of the websites that we use to look that information up for beneficiaries. Medicare can provide that information through their Medicare Plan Finder. I like to use the website RX Assist because if there is a program, it also allows you to download the actual applications. But again, we're also happy to help people in that situation look for those patient assistance programs to see if we can find other ways for them to save money. So, any questions about any of that? So with all of that said, and knowing that all of the drug plans out there, including the ones that are part of Advantage plans, will have a different formulary or different list of drugs they cover. They will all have different copays, different deductibles, different premiums. How are you supposed to determine what Part D plan is going to cover your needs the best? Because every one of us will have different prescriptions that we need covered. So we need to find a plan that's going to cover all of our medications for the best, lowest price. So those are the things you'd want to take into consideration is what a plan's premiums are, what it covers as far as the formulary list, what your copays are. Copays will vary from pharmacy to pharmacy. So how you might do that? Well, the worst option would be you pick up the phone and you call every Part D plan, ask them if they cover your specific medications, what the copays are, what the premium is, and then add that all together and see what you come out with. Not very practical because there are 27 Part D drug plans, standalone drug plans, and that doesn't include the drug plans that are part of Advantage plans. You could contact an agent or broker and let them do that for you. Unfortunately, they will probably come back with just a limited number of options, whatever they contract or sell. Or you can take advantage of the best option, which is a search engine that Medicare has created that's embedded in their website that basically does all that work for you. So the search engine basically allows you to enter all of your specific medications down to quantities and dosages, allows you to add up to 5 preferred pharmacies, and it will compare that information to all the plans out there and do all the work for you. Again, that's on the Medicare.gov website. Handout. This is one I provided in week 1 that just kind of explains how to create your own personalized Medicare.gov account. Again, strongly encouraged by Medicare that you do that, but not required. And it's not required for you to use this search engine either. So I'm going to do a couple of slides here that are going to show you the Medicare.gov screens to find that search engine. So if you go to Medicare.gov, this is the home page. This will either look exactly like this or very similar to it. It will have these 4 boxes for you to choose from as far as something to look at. And what you'd want to look at is you want to check the box that says find health and drug plans and just click the green box. And that's going to take you to the next page where it's going to say explore your Medicare coverage options. If you do not have a Medicare account, a personalized account, you would continue without logging in, which is over here that I've circled. If you have an account, you simply want to log in. If you create an account and you add all of your medications into the search engine, your account will save that list of drugs so that you wouldn't have to type it in next time you log in to look at this information. Without an account, you would have to enter your drugs manually every time. So we're going to assume we're continuing without an account. At that point, it simply wants you to put in your zip code, and it's going to ask you what plan you want to look at. And so this drop-down box would actually say, do you want to look at drug plans? Do you want to look at Advantage plans? Do you want to look at supplement plans? What do you want to look at? And you pick it. And I think because we're looking pretty good on time, I'm actually going to go to the website and just walk you through that process real quick, just so you can get a sense of what it's like. I'm going to stop sharing here. Second. Gonna go online. So this is the Medicare.gov homepage. It says welcome to Medicare. Here we have our 4 boxes: log in or create an account, find health and drug plans, find providers, talk to someone. So again, we're going to find health and drug plans. We're going to assume that we don't have an account, so we're going to continue without logging in. We're going to put in a zip code. I'll put in my zip code just because. Hit continue. It's going to ask me, what do I want to look for? I want to look for drug plans, Medicare Part D. It's going to ask me if I qualify for financial assistance or extra help. I'm going to say I don't. And then it's going to ask me, do I want to see the actual drug costs when I compare the drug plans? Absolutely, I do, because that's going to be the most important factor of what I enroll in. And then it's going to let you add in your medications. Again, it's going to let you add in your medications very specifically down to quantities and dosages. So I'm going to put in, let's say, lisinopril. Once I start typing, it wants to give me options to pick from. I'm going to pick lisinopril as one medication I take. And ask me, what's my dosage? I'm going to let it default to 10 milligram tabs, 1 tab a day. You can pick every 2 months, 6 months, once a year. Then I'm going to add it. That's 1 drug on my list. I'm going to add another drug. I'm going to pick a brand name drug. Let's say Eliquis. There it is. I'm going to add it. I take 5 milligram tabs. I take 2 tabs a day, every 30 days. I'm going to add it. That's the only 2 drugs I'm going to take. So I'm going to say I'm done adding my drugs. And then it wants to know what pharmacy I go to. It's going to show you on the map every pharmacy within a certain radius of miles from the center of your zip code. So because I put in a Colorado Springs zip code, it's going to show me a lot of pharmacies. Obviously, in a rural area like you guys have, you're going to have to go out like a 50-mile radius or 100-mile radius to find pharmacies that are close to you, but it will list everything available within that radius. So I'm going to say I'm going to pick Walmart. I'm going to pick Walgreens. And that's it. I'm going to just pick 2. It also will let you, every Part D plan also offers mail order. They're required to offer you mail order as well as pharmacy pickup. And there could be some significant savings through the mail order programs. So I'm going to go ahead and pick mail order just for the heck of it. So I've picked 3 pharmacies down the bottom here. I'm going to say I'm done picking pharmacies. And now it's doing all the math for me. It's taken those 2 medications and the costs, compared them to all, 27 Part D plans to choose from in Colorado. And now it's listed all 27 plans in order of the plan that would save me the most money at the top of the list to the plan that would cost me the most money at the bottom of the list. So it's going to be in order of the most cost effective to the least cost effective based on the 2 medications I gave it. So we've got the first plan that comes up at the top of the list called Cigna Saver. It has a $12.50 monthly premium. But the number I want to look at with the most interest is this number in the middle, under where it says total drug and premium costs for the rest of 2023, because it has done the math and it has added up what this plan would cost me in copays and premiums and deductibles for the rest of this calendar year, based on the fact that if I enrolled in this plan today, it would go into effect the 1st of next month. So it's calculating from May through December. And this is what it says I would have to spend out of my pocket in premiums and copays and deductible if I enrolled in this plan for the rest of the year. And as we go down this list, you're going to see that number get bigger and bigger and bigger. Not by a lot, just a few dollars each time. But the further we go down the list, that bigger that number starts getting. So it's, again, sorted these plans from the plan at the top of the list that's going to save me the most money overall. And at the bottom list, it's going to cost me the most money for that plan. So if I go back to the top of the list, that $12.50 plan, it does have a $505 deductible. Any of the things on this site that you're looking at, if you're doing this on your own, anything that's underlined is going to be a link. If you click on it, it'll give you more information. But I want to know the details of this plan. I want to know what my copays are going to be. So I'm going to click Plan Details, this blue button. And it's going to show me all the specific costs for my drugs with this plan. It writes the premium of $12.50, the deductible. Shows the 3 pharmacy options that I picked are all preferred pharmacy options in network. The other option that you might see under this is just in-network pharmacies. Or non-preferred or non-participating pharmacies. There are some plans that do not participate with some pharmacies, and it will tell you that. It's going to list the 3 pharmacy options that I chose, and it's going to show me what each drug would cost at those pharmacies for the year. So they're going to separate the 2 drugs. With this plan, at any pharmacy, the lisinopril would be 0 copay. The Eliquis, on the other hand, is an expensive medication. Typically retails for around $500 or more a month. With this plan for the next 7 months, my total cost in copays would be $970 or so dollars. You'll notice with mail order, that cost is actually higher. Mail order can provide some significant discounts on your prescription costs for generic drugs. But when it comes to brand name drugs through the mail order, typically you tend to pay slightly higher copays for some reason. Scroll down a little bit more. It's going to reiterate that cost, that total cost estimate that was on the comparison screen for each plan at each pharmacy. And you'll see the cost can vary slightly from pharmacy to pharmacy. This one's only by $1 or so. Shows when the plan would start, when it would end. It's also going to show you if you hit the next level of your coverage, such as the coverage gap or the donut hole. It's going to tell you when you'd meet your deductible with those drugs at those pharmacies with that plan. So it gives you all the specifics. And then it goes and breaks it down by month. With this plan, to get those 2 medications every month, first month is going to cost me $545 because I have a deductible to meet of $505. The next month, I've met my deductible. My copays go down to $40 a month. And that's going to be the $40 copay for the Eliquis. Because again, the lisinopril is 0. And it's going to show me that that's what I'm going to pay for most of the rest of the year, is just the $40 copay. But by December, I've reached that last stage of coverage. I've hit the other side, I've gone from the initial coverage level to the donut hole level. So again, my costs go up. Now I'm paying 25% for that lisinopril instead of $0. And I'm paying 25% of $500 retail cost for the Eliquis instead of a $40 copay. So my cost at the pharmacy goes up. And then again, come January, it starts all over with the deductible. And then if I click in the specific pharmacies, it's going to show me what my copays are actually in each coverage level. During deductible, after deductible, when I hit the next level in the coverage gap. That's what my copay goes up from $40 to $162. So this website provides, the search engine provides you with a ton of information to use to compare your actual costs with these drug plans. And you can do the same thing with the drug cost coverage options through the Advantage plans individually. So this is just going to show me the drug costs for the individual standalone Part D drug plans. These are the plans that I would purchase if I went with Medicare and a supplement, for example. These are not the plans that would be included if I did an Advantage plan that had a Part D benefit already attached to it. But if I wanted to look at the Advantage plan's drug coverage, I could either go back and start over, or I could just go up here and this little underlined sentence says view 30 available Medicare Advantage plans. If I click on that, it's going to show me 30 Advantage plans. These Advantage plans are also going to be listed in order of the plan that would save me the most of my drugs at the top of the list to the plan that would cost me the most of my drugs at the bottom of the list. It's going to tell you what kind of Advantage plan it is. This one's an HMO. My estimated total drug cost for the rest of the year, you'll notice, is significantly lower with the Advantage plan than it was with the Part D standalone plan, by almost 2/3. This plan has no premium because it's the Advantage plan, so you have no premium for the drug benefit. If I click in here, it's going to show me everything. It's going to show me the copays for all medical services with the Advantage plan. There has deductible. This plan does not. Has a max out of pocket. It's going to show me copays for office visits, lab work, x-rays, ambulance rides, hospital stays. Get further down the list, it's going to show me drug costs. So here's the Part D benefit through the Advantage plan. It's showing Eliquis, total cost for Eliquis for the rest of the year. Again, much, much lower than it was with the standalone plan. Because the cost is much lower with the Advantage plan's drug benefit than it was with the other drug benefit, I'm not going to hit that last level of coverage. I'm not going to hit the donut hole before the end of the year. If I look at Walgreens with this Advantage plan, it's going to show me that I have no deductible. That's where I'm saving most of my money, is I'm not paying that initial $500 deductible. My copay is slightly higher, $47 versus $40 for Eliquis. Still have zero copay for the lisinopril, but it's because I have no deductible with this Advantage plan. That's where I'm saving all the money. Those are the kinds of things that you would want to look at and take into consideration. Certainly, I wouldn't use this information as the sole reason for enrolling in an Advantage plan. You'd really want to consider all the pros and cons we talked about last week, because you may save money with your drug coverage, but you might lose money or spend more money on the medical copays. So you really want to look at those two things carefully. And that's going to be based on how often you go to the doctor, what your needs are, that kind of stuff. If your providers participate, if you have participating providers in your area, all of that kind of stuff. But it's, again, the search engine gives you so much information, usable, accurate information, in order to help you make those decisions. And you can compare up to 3 different plans in each category side by side and look at those costs side by side instead of scrolling up and down. So that's a helpful feature. During the annual and open enrollment period, this is all we do. People come to us to do the search engine for them, and we help them compare those options. We usually look at the top 3 options of what they are interested in looking at. We look at the costs, the pros, the cons, and if they choose to make an enrollment, we help them with the enrollment as well. But this is not anything that you couldn't do on your own, because if you'll notice, there is also next to the plan details button, a green enroll button. And if you hit that enroll button during an enrollment period, it'll walk you through a very simple application. If you've created a personalized account, that application will automatically be pre-filled with your information. If you haven't created an account, you'll have to type in your Medicare number and such, but it walks you step by step. And once you hit submit, everything else takes care of itself. But again, you can only do that during an enrollment period or a special opportunity. Otherwise, you're able to go into this search engine and just play around with it. You can't enroll outside of a genuine opportunity to enroll. You can't screw anything up in here. You can't accidentally do anything. So it's always something that if you're interested in doing, you can go in there and kind of play around, add different medications, and just see what you find. If this is something you wanted to look at during the next open enrollment period, you're welcome to call us. I will probably be doing at least one class at some point before open enrollment starts, specifically on how to use this plan finder. And if I create that class, I will certainly let all of these host sites know, so that if that's something you're interested in attending, you'd be welcome to do so. All right. Any other questions about any of that? Oops, I want to go from beginning. I think that was pretty much all we had. I'll walk through the plan finder. Resources, if you wanted more information, again, you can always go to the Medicare and You Handbook. I need to change the year on that slide. You can always go to medicare.gov. You can call 1-800-Medicare, again, 24 hours a day, 7 days a week, 365 days a year. The Division of Insurance up in Denver also puts together a list of all the plans available in the state. They used to do like a printed newspaper type thing, but because of COVID and costs, they stopped doing it. Now they only post it on their website, but it's basically going to show you a list of all the plans out there and available in Colorado. Side by side, it's going to give you their copays, averages. It's going to give you their premiums if they have a deductible, and it's going to list all the plans out there. It's not going to be anywhere near as comprehensive as using the plan finder on the website, but it can be some useful information. And that's about all I have for you. Again, we also do SMP that provides education and assistance to combat fraud and abuse with Medicare and Medicaid. If you have any additional questions, you're always welcome to contact us. Again, I have 4 other full-time counselors that are able to help you. I have 2 part-time volunteers. You can always shoot me an email and I'll be able to get back to you within 24 hours. If you want to talk to someone in person, simply call that number and ask for a SHIP counselor or a Medicare counselor, and someone will be able to help you much, much quicker. And that is all I have for you today. Any last questions before I let you go? Yes.
Yeah, Roma, we have a question.
Absolutely.
If COVID-19 vaccines are still covered.
Are COVID-19 vaccines still covered?
Yes. So COVID-19 vaccines will probably become part of the preventive service or annual vaccine coverage of Medicare, where it will be covered at 100% in most cases. They're still kind of working that out with the manufacturers of those vaccines, because the manufacturers are starting to talk how much they're going to charge for them now that the government's not paying for them. And it's a little outrageous. So I think they're still kind of in the negotiation process. But yeah, it will be a benefit of Medicare. Whether you have that
Thank you
through
very much.
original Medicare or an Advantage plan, absolutely.
Thank you.
You're welcome. Any other questions, comments, concerns? Nothing? All right. Well, again, I appreciate you coming and talking to us and sitting through our presentations. We do have one more presentation to go. Next week, we will talk about Medicare and any other kind of insurance option that might be available to you, including employer, retiree coverage, Medicaid, TRICARE, VA, that kind of stuff. That is usually our shortest presentation, so it'll be short and sweet, but certainly happy to answer any other questions in the meantime. Again, if you did not get the email that included the handouts for today's presentation, please shoot me an email and I'll make sure I get one sent to you. Otherwise, I'll let you all go and I will hope to see you next week. And we appreciate you sitting down with us and listening to all this wonderful, wonderful information.